Now, what about medical treatment? We've talked about medical treatment. It is the mainstay. Unfortunately, there's very little in the term of medications that are beneficial. There are a few medications that have come out over the years. They can have a minor effect, but to date there is no clear long-term benefit for medications, and they do have significant side effects. Exercise and diet are the mainstay. And again, what is appropriate diet? We tend to think of a high-protein, low-carbohydrate diet as one of the best diets for weight loss. Maybe it is, maybe it isn't, but data would indicate that it is one of the better diets. But again, it has to be a lifestyle change. And again, changing the whole environment in this toxic environment is very, very difficult. Behavioral modification, again, a very common catchphrase. We need to change your behavior. We need to go through these. Who knows the right way? The truth is, on a wide population-based scale, we have no clear-cut means of changing behavioral modification. As a result of this frustration, scientists have looked into this, and in 1991, the National Institute of Health had a big meeting, big symposium, invited scientists from all around the world to look at the problem of obesity. And in 1991, they came up with this statement. They stated that severe obesity is a chronic condition that is difficult to treat through diet and exercise alone. Gastrointestinal surgery is the best option for people who suffer from severe obesity. Now that's pretty scary. This was 1991, and in fact, further on in this same document, they went on to say that obesity surgery was the only reliable long-term treatment for severe obesity. Now they were talking primarily about gastric bypass. Now again, this was 1991, and the National Institute of Health was asked to revisit this subject in 2004, and they stated no, they were not going to revisit it. The reason why is nothing had changed since 1991. Now, the American Diabetic Association sets out guidelines every year for physicians to help give them direction as far as treating diabetes. And in 2009, the American Diabetic Association, looking at obesity surgery as a treatment for type 2 diabetes, began to recognize that this type of surgery is the most effective treatment that we know of today for type 2 diabetes. And although they're an organization that deals primarily with medications and behavioral treatment of diabetes, they came up with this statement. Bariatric surgery should be considered for any adult with a body mass index of 35 or greater, especially if the diabetes or other associated comorbidities are not adequately treated by medical means alone. Now, the American Diabetic Association, in their 2010 consensus pamphlet, also pointed out that, in their opinion, less than 10% of type 2 diabetics in the United States are adequately treated. So in essence, it says if you're type 2 diabetic, and you really should consider one of these surgeries.